Welcome to our third webinar of the year. I can't believe we're on three webinars already. Time is absolutely flying, isn't it? So this one is backed by popular demand and a subject that's very much in demand through our website and helpline, and that is foot care. It will be recorded, so you'll be able to watch it. So if anyone hasn't made it that you know of, please tell that it'll be on our website probably by Friday. It's going to be on the website to watch again. If you have any questions, please put them in the chat. And what I'll do is at the end, I'll read them out to our presenters and they can answer the questions. So let's get started. And I welcome to the screen, Joe.
Hello, thank you. And my colleague is with me as well. I can't see you at the minute, but I think you're there in the.
Yeah, hi.
Let me just share my screen then with you, and just let me know that you can see it. I'm going to just start the slideshow, and
That's
that's
all good.
Yeah. So my name's Jo Casey. I'm a podiatrist, and I am based down in the south of England in Oxfordshire, and I've been working in podiatry now for about 25 years. I've done some work at the University of Southampton. I've done some work in the NHS, but I've got a real sort of passion for trying to support people living with kidney disease. And I'll pass over to Ljubisa.
Hello, and welcome to this webinar. So, as Joe introduced me, my name is Ljubisa Paden. I'm a registered nurse by my background. I work in tissue viability nursing, so wound care nursing for, well, more than 15 years now. And currently I work at the University of Manchester as a lecturer in nursing. Yeah. So, shall we start, Joe? Is that all right? Yeah, okay. So, perhaps before we get into the detail, why is foot health such an important people with kidney disease?
So foot health is really central because the feet are so often complications that first show up within the feet. So with kidney disease, we see changes in circulation, nerve function, and healing capacity sometimes. Things don't always heal quite as quickly as maybe they might have done if we weren't living with kidney disease. So that means that there's sometimes even more issues like a small cut or a pressure point become quite serious quickly if it's not managed early. And from your perspective, Ljubisa, as a nurse, what are you seeing in patients day to day?
Yeah, so we often see that patients don't realize how important their feet are until there's a problem. Many are focused on dialysis, medications, which is really understandable. So sometimes foot care, I would say, slip down to down the priority list until something like a wound or infection develops.
So why are we talking about feet? We say that small problems can become big ones. And can you give me an example, Ljubisa, about what you might see in practice?
Yeah, absolutely. So something as, for example, simple as a dry skin or a small blister quickly turn into a wound, especially if the patient doesn't feel or, for example, keeps walking on it. But by the time they present, it can already be infected, and sometimes clearly it will heal slowly due to the kidney disease and potentially also other conditions they have. But this webinar is about walking, and despite all the complications, we are still encouraging people walking. So why is that important, Joe?
Walking's incredibly important and incredibly beneficial. We know that walking improves heart health, so it improves circulation. You get good cardiac output. It's important when we think about supporting our cardiovascular health that we try and get ourselves a little bit out of breath, just because otherwise you can have quite a slow cadence or a slow walking speed. You're probably not giving your good cardiac output as if you were trying to just get a little bit more exertion. So don't get they suggest that you should be able to sort of speak but not sing, necessarily when you're walking. So try and get your heart rate up a little bit. Not too much if you've got some heart conditions, but just try and raise and elevate your heart rate a little bit, just to try and get your cardiovascular health improving. The other thing with walking, of course, is that it helps with blood sugar. So, of course, when we walk, we're using the energy within our muscles. And that energy has come from food. So, of course, actually, it tries to keep our glucose down and maintains the food that we eat into our muscles in a proper, balanced way. And, of course, walking, we know, boosts mood. So we know it brings our good endorphins. Become happy after you've had a walk. Often it can be social. So, of course, you might be walking with friends or family. And so actually that can sort of really bond your kind of social aspect, maybe build in some habits, and where maybe you meet people every week to encourage each other to walk. So, a walk around the block after eating, after it's digested a little bit as well. So don't go straight out and give yourself tummy ache. But, get your walking out, put your good shoes on, get your heart rate up a little bit and sort of digest that food, the glucose that we've just been eating, and try and get that mood boost as well. And the key message isn't to avoid walking, it's to walk safely and be proactive about your foot care. So although we know living with kidney disease, you can sort of develop small problems, could get slightly bigger with that lack of healing, the neuropathy, the poor circulation, it could actually, be beneficial to get out there because it helps your cardiac health. So it is important to keep walking. It helps your mobility, your stability, and all those sorts of things. So it's really to be proactive about thinking about how you can walk safely, and to encourage, good health.
And can you perhaps break down what's actually happening in the feet with chronic kidney disease?
Yeah, sure. So we commonly see reduced blood flow, usually because kidney disease tends to affect microcirculation, and it can mean that we don't necessarily get those small vessel tissues to get enough oxygen and nutrients. We can also start to see some nerve changes, where patients may lose some sensation in their feet. Particularly if you live with diabetes, that can be exacerbated, but also as we get older, we do tend to sometimes find that we can get some nerve deterioration as well. So, of course, it's not sort of something that none of us are exempt from, but living with chronic kidney disease can actually exacerbate some of these problems. So we can get reduced blood flow and nerve changes. On top of that, we might get some swelling and some fragility to our skin. And that, of course, increases the risk of breakdown. And then if we get a tissue breakdown, that gives us a portal of infection potentially, because it could get into the skin. Because our skin is the largest organ of our body, the largest living organ of our body. It's absolutely amazing. It protects us from the sun. It protects us from the environment. It protects us from infection. It coats our inside, so it makes sure that everything stays in place. But it's one of those things that is, if it breaks, it can be incredibly fragile. And then, of course, we can get that infection that comes in. So we have to be quite careful with that. But from your side, Ljubisa, do patients usually notice these changes themselves?
Well, not always, I would say. And that is one of the challenges, especially when you have a nerve changes, as you have mentioned already. So patient might not feel the pain, or have lost this protection sensitivity, and they assume often that everything is fine. So that is one of the reasons why we emphasize, for example, routine checks rather than relying only on symptoms and signs.
Yeah, that's the thing, isn't it? We do rely on symptoms, and of course, and then signs. So we do really ask people, don't we, to kind of check their feet regularly so that they can sort of notice any changes. And of course, we've usually got 2 feet, so it's good that you can see both.
Both.
Yeah, and one of the things with neuropathy, don't you find that often it's only when you've developed a problem that you realize you can't feel your feet, because your nerves don't tell you, do they? They don't just say, we're suddenly not going to feel anymore. And you don't your feet don't change a different color. There's no alert, is there? So we normally ask people to go and get tested for nerve changes. which is, usually quite helpful. In podiatry, we do that as part of our standard neurovascular assessment. So we would check the pulses in the feet. We would even go up towards the back of the knee and check the circulation coming down the leg as well to make sure that was okay. But then with neuropathy, we would start to look at sort of sensory nerves. So that's the ones that give us the touch and temperature. And we would look at using things like monofilament, which is like a little small toothbrush bristle type of piece of kit that we pop on the foot in several places and ask people if they can feel it. We might also use a tuning fork to sort of see whether you can feel vibration. And the tuning fork is quite useful because it sometimes identifies whether you'd feel a blister forming. And then often when the blister breaks, then that's when actually you would definitely notice, usually if you've got good feeling in your feet. But sometimes that blister forming you can't feel. And that's so important with walking because it's quite so easy to develop a blister. So it's, but also with circulation, you can start to pick up skin changes when you look at your feet if you've got poor circulation, because you might start to see the skin goes quite dry. You might start to notice some muscle wastage. It might be that you get a lack of hairs on your feet. I mean, we usually sort of, especially myself, I'm not particularly keen on having sort of hairs on my feet or on my legs. So, but actually, sometimes it might be that they've been rubbed off with socks, bit of friction. But actually, if you start to notice the skin changes, there's a lack of hair, maybe there's a colour change. And usually the colour change associated with reduction in blood flow can be that we, depending on your skin tone, so it can be quite subtle changes, especially in darker skin tones. But the changes might be sort of a slightly pallor sort of colour. But in a darker skin tone, you might notice those changes going slightly darker than normal. So it's sort of really keep an eye out on what your feet look like, because as Ljubisa said, you don't always necessarily know. So get those foot checks as well.
Would you say, sorry, just to add to that, would you say that skin becomes a bit shiny as well? Could
Yes,
that be one? And also, when you explain that loss of hair, would that be typically, for example, on toes, or would it be even higher? What are your experience on that? Because I think that people tend to notice, as you have mentioned, oh, beforehand I had to remove my hair if I, do that for my cosmetic reasons or aesthetic reasons, and now I don't need to do that anymore.
Yeah, no, it's sort of, we'd start to sort of see specifically, because you might start to sort of notice this kind of there'd be maybe a fluid reduction within the foot, so that the toes might look a little bit less plump than what you might have had them before. So actually, you sort of start to see the changes of lack of hair on the toes. You might start to see it on the foot, up the leg as well. So you might just start to see this atrophy and this sort of skin and keratin change. And of course, hairs are keratin, so you might sort of see that. Those changes coming right up sort of like mid-calf kind of level and higher actually sometimes. So that's where we would see it, Ljubisa.
Oh, amazing. And sorry, just a quick question
Right.
about the temperature, because you have mentioned that as well, and also emphasize that we really need to check both anatomical locations. So look at both feet rather than one feet in isolation. So would you say that patients would usually feel cold in their feet or
Yeah, no, exactly. So with a lack of blood flow, which is usually, our core body temperature is at 37.6, isn't it? Or 36.5 degrees. So anything sort of cooler than that. So you tend to sort of find actually your lack of blood flow. So you would start to feel a bit chilly, especially in the colder weather. Sometimes we can sort of feel that our feet are cold. And we think, oh, it's bad circulation. It can just be, of course, it's cold weather and our microcirculation has just retracted back a bit to keep our core warm. So it's really important to get your pulses checked and to make sure that they're okay. But yes, it can be that they go a bit chillier and a bit cooler. And check between the 2 feet, like you say, because you do have a comparison. And often changes in blood flow, although they can be in both, and it's not unusual to have it in both, it's not normally sort of necessarily symmetrically systemic. So you'd normally find that one might change before the other. Or you may develop it in both, but you may find it's worse in one leg over another one.
Yeah, great. And if we move a bit forward, because we are talking about kidney disease as well, how does dialysis add another layer of risk?
Yeah, so with dialysis, of course, the causes of fluid shifts, and which can increase the swelling in the feet. So you can see here we've got a very sort of pitting edema style of foot, where you can actually, good example when you mentioned just before, Ljubisa, about the shiny skin. You can kind of see that shine on that skin a little bit there, and also there's some dryness. There's a lack of hairs on that foot. So it might be that actually there's some, vascular changes and neuropathy going on. But actually, yet one of the main things with dialysis will be fluid change. So often that skin then with fluid change, if it becomes swollen, can become quite dry and itchy. And patients can feel quite fatigued afterwards as well. So all of this just increases the risk of pressure areas too, because if you're lying on a dialysis bed, for what could be sort of 4 hours or longer, if you've had to wait to get put on the machine, you can start developing areas of pressure. So it's good to check things like your heels, your ankles, as well as obviously other areas that might develop pressure, and that might be your sacrum. But it's just to be mindful. I know that in hospitals sometimes they can give you air beds, pressure redistributing beds. But also if you are finding that you've got some risk associated with your feet, some neuropathy or some circulatory problems, you can try and get some pressure relieving booties that can just take your heels off the end of the bed. So yeah, fluid change is a big one when it comes to dialysis specific foot conditions. So after transplant, patients often can feel better. So we're going to sort of move on to transplant patients a little bit here. But are there still risks for the feet, Ljubisa?
Yes. Steroids can thin the skin and affect also bone strength. And we know that people who had transplant are also on immunosuppressants, which increase infection risk. But nevertheless, we would encourage patients to walk after transplantation, clearly when they are cleared by transplant team. And from podiatry perspective, what should patient focus on post-transplant?
Yeah, so post-transplant, I think it's really key to return to activity gradually. Don't rush back into long walks straight away. I mean, I guess that's sort of a similar thing actually to possibly being on dialysis. So once you've had dialysis, or if you've obviously had your transplant too, just slowly get back into it, because there can be blood pressure drops, there can be all sorts of other things going on. So just slowly get back into long walks, if that's what you currently do. Good footwear, of course, is important, and regular foot checks are essential to make sure that when you are upping and increasing your walking, that actually there's no problems that might occur, so that you're beginning to feel better, you feel well, and you've got good foot health. So just keep an eye on everything and keep a check, especially because you can be so vulnerable using immunosuppressants and steroids. So gradual return is really good. And footwear considerations, we've got some slides later about footwear considerations, but mainly a comfortable shoe, but we'll talk about that a little bit more later on. So when we think about living with diabetes and CKD, because it would be remiss of us not to include diabetes really into this, because there is a high percentage of people that live with diabetes and chronic kidney disease. This combination means that we must be proactive and not reactive to problems. So obviously reactive, the problems have risen, but we want to try and prevent it happening in the first place. So why is the combination of diabetes and chronic kidney disease particularly high risk, Ljubisa?
Yeah, so we already discussed today about the neuropathy, which clearly reduces this protective sensation, so patient won't feel injuries, friction, for example, small stone in a shoe. We also know, as you mentioned, the circulation is also compromised, and we can expect that healing of even very small injuries will take more time than when compared with people who don't have diabetes or CKD, and also infection risk is higher. So it's a combination, I would say, that significantly increase complication risk, and you cannot take one condition from another. So it builds on. It's just a layer and layer of risk. Yeah. And what do you find patients are most surprised by when they have both conditions?
Yeah, I think I alluded to it a little bit earlier, really. It's that unawareness of potentially a problem that's not been assessed or had its awareness raised. So it's things like pain, so things that can happen without pain, because actually if you don't realize that you're neuropathic, then actually it might come as a surprise to you that suddenly when you've taken your shoe off, your sock is very damp. And when you've looked at your damp sock, you've realized that it's been bleeding because maybe your toenail has been dislodged, or you've got some blood in between your toes because you've got a blister that you didn't even feel appear. So that's tends to be the things that surprise us. I mean, a very sort of a good example, but a rare one, thankfully, is I remember going into a nursing home and taking off a patient's slippers to then have a little look at her foot. And when I went into the slipper, I found a pair of scissors. And she actually didn't realise that she'd been standing on these scissors. She actually wondered where they were, funny enough, but she didn't realise that she had safely put them in her slippers and then stood on them. So again, she didn't even know that she didn't have any feeling. But of course, when I then looked at the bottom of the foot, because of some of the swelling through the kidney disease, there was actually an imprint of the scissor on the plantar aspect on the bottom of her foot. And of course, if that had gone unnoticed for several hours, it may have started to develop a pressure point and possibly even broken the skin. And then when we've got that break to the skin, we're a little bit more vulnerable. And of course, we know pressure, we're a little bit more vulnerable too, because pressure damage to the skin can mean that the skin can begin to break down, and then you might develop a sore or a wound or an ulcer. So it's quite important to get your feet checked, just to reiterate those things. There are also conditions, especially living with diabetes and neuropathy, but all neuropathy, because you can get this condition without diabetes, and that's something called Charcot foot. And Charcot foot is an inflammatory condition that breaks down the bones become quite soft and they break down and then they fuse in a way that doesn't allow good range of motion with that original joint function. And so actually understanding if you've got some neuropathy and if you're at risk of these things is a really good idea. So really to get recognition early and to get assessed is great. So if you are living with CKD and diabetes, it's even more important really to make sure you get a good foot check.
Amazing. So on this photo here, or sorry, on previous slide, you actually had like a monofilament test. So if people are here and didn't understood about the monofilament test, it's really nicely presented here.
Yeah, that was the test for neuropathy that I mentioned earlier. Yes. I'm glad you got this. I've forgotten that was on the slide. So well done. Thanks for reminding me there, Ljubisa. So the reason we were asked to talk, not only because we were backed by popular demand, apparently, thank you very much, everybody, and thank you, Pete, for the invitation. It was because Pete linked really the idea of your National Kidney Federation's Walk or Run Challenge in April. And April's only around the corner, believe it or not. Can't believe nearly a quarter of the month of the year has gone. But the National Kidney Foundation are asking us to try and walk or take 72,208 steps in April. And actually, when you break it down over the month of April, it's actually not as far as you think. It's only 2,406 steps per day. And so this is the 2,000 step challenge, or 2,406 step challenge per day. And we'd like to think really that this might be an achievable, safe and beneficial challenge for everybody to participate in. So I think my understanding is that the National Kidney Foundation has probably already alerted you all to the challenge. But if we think about putting our best foot forward, try and get in 2,406 steps, which is very, very achievable, I think, for most people. So do try and get it in. You'll be surprised how many steps you do, I think, per day. So try and get in 2,406 steps. So we're promoting it, and we're promoting walking. That's why we're talking about foot care today. Is how can we get you all out? How can we start walking, encouraging good cardiac health? So what benefits should we be highlighting to patients then about this?
Yeah, so we already discussed that at the very beginning of today's webinar, but we do explain that walking helps circulation, it supports heart and kidney health, it improves energy levels, and it improves mood. It is accessible, so you have to just find your good trainers which are comfortable, clearly, and you can just start walking, and you can build up actually that momentum in a way. So each step count. I like this slogan in a way. So don't go out and rush and do, I don't know, 20,000 steps in a day. You could start with only few even. But I think that, yeah, building a momentum can then also help from social perspective, because you can take someone to a walk, take a dog for a walk, so it improves mood as well. And from your side, so you said 2,406 steps as a target, but is there a safe target to aim for?
Yeah, I would think so. It's a great starting point if you haven't started your walking journey. And I think if you're already on it, to actually ensure that you do 2,406 steps is actually, achievable. But it also provides meaningful health benefits, like we mentioned before. But I must admit, we didn't mention before about building strength and reducing fragility. So actually, the more we use our muscles, the more that we, use our skeletal system, actually it builds muscle strength, it builds tone, that supports rehabilitation, and can of course reduce frailty, because you keep your muscle tone and your muscle strength up. So as well as your heart health, it actually keeps your musculoskeletal system on form too. So actually walking's great, and you don't necessarily need to walk unaided. So if you require a walking aid, then do use it to help you get by. It's whatever we can do to keep ourselves going. So being proactive rather than reactive is a great thing to do.
And patients often ask, how much is too much?
How much is too much? Well, I think it's a bit of a tricky question to answer, because everybody's so individual. My walking level, I don't know about yours, Ljubisa, but my walking level might be less or more than yours. So actually, how would we know what was too much? So I think we have to listen to our body. And if you sort of then start to approach things small and then build up gradually whilst monitoring the feet and monitoring your health, then I think actually you should be okay. So just be sensible with yourself. So how much is too much? I'd hate to say to somebody that's already very active, you can't go out and do that next 5K challenge. You can't go and do a 10K challenge. You can't go and, walk around the block several times with the dog. I mean, the poor dog probably, wants to get out. But actually, if you haven't started walking yet, then build it up gradually. But what should patients be checking for after walking?
Yeah, so we already mentioned bits and bobs about that, I would say, but check clearly the tops, the soles of the feet, between the toes. You've mentioned that sometimes we can have like a blister, or we call that often kissing ulcer. So it can become a blister between two toes. And clearly look for those typical signs, so such as redness, swelling, cracks, temperature, as you have mentioned already, because temperature will signal that there is some sort of inflammation happening. It may not happen straight after a walk, so it can develop after that. So it is important also to check feet regularly. After the walk.
Yeah, that's great. Any wounds, blisters, with sort of keeping in mind of there's inflammation and infection. But of course, living with CKD, and possibly if anybody's on some immunosuppressants or any steroids, of course, inflammation and infection is impaired. So it's not necessarily going to flare as much as it might do, because of course it dampens down that inflammatory process, which is why it's so important to check and look and gauge and just keep monitoring. And using a mirror or asking for help. I mean, you can put a mirror on the floor and you can put your foot on top of it and you can look at the bottom of the foot. Or if you've got a mirror by your bed, you can maybe lift your foot up. Asking for help is great if you've got someone around that doesn't mind having a check of your tootsies. They're not always the most popular thing for people to check, unfortunately. I completely disagree. For me, they're incredibly important as a podiatrist, but not everybody shares my passion for foot health. So walking is different for everybody, and it's important, as Ljubisa said, just to check and to make sure after walking that everything's still as you'd expect it to be for you. So what does a good daily skin and nail care regime look like then? How do we keep our feet intact, ready for this walk, this 2,000 steps we're about to do, Ljubisa?
Yeah, I would say keep it simple in that sense. So moisturize dry skin, clearly check foot regularly, moisturize dry skin. Nails, I, from my practice at least, I'm not sure, Joe, what is your practice? I think that people struggle to trim nails correctly, especially if, they had like a pattern of oval trimming throughout the years. So also our soft tissue will form slightly differently, and you could have an ingrown nail as well. So it can be difficult to trim nail, especially if people have mobility issues. So yeah, I would say keeping nails trimmed straight across if possible. But if you have difficulties, I would say consult a professional podiatrist, or ask someone who is versatile in doing that. On the other hand, also avoid anything sharp or harsh. So don't use, I don't know, acid products. Don't use any sharp those scrapers, etc. Because you could, especially for people who have neuropathy, can damage their skin with such procedures. So I would say, yeah, also seek professional help. And Joe, you are a podiatrist. When should someone seek professional help, in your opinion?
Yeah, well, I mean, it depends on what it is at first. So if, for example, you have noticed that you've got a split or a crack, your skin's gone red, you've got some fluid or about a funny smell, or something's just not looking right to you, it's not what your foot normally looks like, then I'd seek help immediately. They normally say if you're living with diabetes, you should be able to seek help within about 24 hours. That's the national guidelines. If you've got a foot wound, and that help can be a foot health team. So it might be that there's a nurse part of a foot health team. It might be that there's a podiatrist as part of the foot health team, a medic. But also an MDT, that's a multidisciplinary team. So that means that actually if you have got a foot wound that hasn't healed quickly, you are worried about it, then actually you should be able to see an MDT very quickly indeed if you get a problem. If it's something like nail care or hard skin, then there are things that you can do yourself. As Ljubisa said, you can actually, you can file your nails if you feel confident in doing so. You can file some hard skin, you can apply moisturizer to the hard skin, which you've got to try and avoid between the toes, really, because when you put moisture between toes, it can get a little bit warm in there, and that can just be a little bit of a breeding ground for fungal infections. And you can see in this photo here, the skin's broken down, it's got macerated, it's like you've been in the bath for too long, it's gone pruny. And actually then that can be a portal for infection, that skin that has been broken down. With nail care, if you're living with vascular disease and neuropathy, then obviously that puts you at high risk of developing a problem. But at the same time, if you're capable of filing your nail and you feel confident, there's no reason why you can't do it yourself. But if you've got a strange shaped nail, like a convoluted nail or an involuted nail, or it's thicker, or it's got a fungal infection, it's crumbly, it's broken, that does make a difference. So as Ljubisa said, it can be that the size of the toes can grow around the nails, and actually then you can, if you start sort of filing wrongly or maybe trying to take a pair of nail nippers to it because that's what you've always done in the past and you've been super confident before, but this time because maybe your foot's swollen a little bit more because of your kidney changes, then actually you could end up cutting yourself. So I would get help then sooner rather than later and be proactive. So maybe think, actually, I'm going to go get a foot check annually. And at that point, I'll ask the podiatrist how I can self-support, so how I can do it myself and what they might need to help me with. And so seeing a podiatrist early can prevent much bigger problems. But you see your feet every single day. The podiatrist doesn't. So it's important that you understand, what you can do for yourself, but also know when you can ask for help. And there is help out there. And certainly there's a Find a Podiatrist link on the Royal College of Podiatry website that looks at independent practitioners if you're unable to get support through the health service. But equally, you can go through the health service and ask your GP to refer you to podiatry, especially if you do have diabetes and kidney disease, because that does put you at a slightly higher risk of developing problems. So there is access within the health system, but equally, if you wanted to seek somebody privately, then Find a Podiatrist is a reliable way of finding a practitioner that's registered with the Royal College. And to be registered with the Royal College currently, you have to be a podiatrist, and that to be a podiatrist, you have to be registered with the Health and Social Care Professions Council. So there's that would be a good link to go to.
So we often underestimate footwear. How important is it really?
So it's one of the biggest protective factors, really. Footwear is a good fitting shoe is really protective of your foot. Poor footwear can create pressure points, leading to breaks in the skin, which can lead to an ulcer. Or it can lead to pain if we get it wrong, or an ingrown toenail or a blister. So it's one of the protective factors to try, if we're thinking about going out walking, do think about good fitting footwear. And what sort of advice with footwear then, Ljubisa, would you normally give people when we're thinking about a good shoe?
Yeah, I'm sure that you will add to this because you're a podiatrist, but still, choose shoes that fit well, and based on experience online shopping as well. This photo here shows you actually that each foot here is a size of is it 8? Yeah, here sorry, my screen is a bit I cannot see the size, but anyway, the size is the same, but the width of the foot, so is it medium or narrow, is different, and also the arch in every single foot is again here different, and toes are positioned slightly differently. So it is really important that you figure out, that you test a footwear, that you check, when you try them in the store, whether you have enough room between the end of the shoe and the big toe as well, and that you can spread toes in the shoe box as well. So making it really sure that it is the right fit. Also check perhaps for the supportive sole, so whether it will support arch. Is it thick enough? Is it soft enough perhaps? And also if you're using velcros or laces, making sure that the shoe can be adjusted enough. So yeah, so that the foot is not moving up and down when you are walking. But please, Joe, chip in here because I think you're an expert.
Yeah, no, I think that's really important actually, the fastening thing, because with kidney disease, we do develop some swelling, and that swelling can fluctuate throughout the day. It can fluctuate each day. It can be different per month. And if you're starting to lose some of your filtration, so in other words, you're going down towards possibly being on dialysis, you might find that actually your feet and legs do become a little bit more swollen than what you have known before. So actually to be able to adjust your shoes, if you're going out for a walk, which we know increases cardiac output because we're going to get our heart rate up, we're going to go for it and try and really try and enjoy our walk. So we're going to start to develop some swelling in our feet anyway, naturally, as part of the walking process. They're going to get warm when we're walking. We might develop a little bit more moisture when we walk. So, of course, if we think about moisture and warmth and swelling, that's just one big kind of recipe for potentially getting a blister. So if that shoe isn't fitting properly, or it's too tight, or we've squeezed it in, then actually that pressure damage on that skin could be a little bit more prevalent than what it might have been if we'd had a better fitting shoe. So having the adjustability within the shoe enable you to open up the laces. So if you have gone for a walk and you think, oh, actually, my feet have got a bit swollen, I'll just open up the laces a bit. Or if actually one day you've just had some fluid retention treatment, and actually the fluid's come off and you've got a much slimmer foot, it means that the shoe's still going to fit because you can just adjust the laces and then you can get going again. So for me, the adjustability of laces or Velcro is a really important thing to consider when it comes to shoes. But of course, they're not only just shoes, are there? What we have to consider socks as well. And I'm sure socks are a bit of a bane for everybody's life, actually, because they can be too big and too small. But, do socks really make a difference, Ljubisa, when it comes to thinking about good foot health and walking?
Yeah, I think that they do, especially for patients with sensitive or swollen feet, as people with CKD would have. So we would recommend seam-free socks because they reduce rubbing, and perhaps also when choosing socks, consider that they don't have this tight elastic, which will, impair circulation, venous circulation mostly. So it will, I think that I have marked it here with red dots, if people can see. So just thinking, when we put our socks, sometimes because of the seams very next to the toes, can start rub with the shoe, and actually there is a high pressure area where we will develop some sort of an injury. So this is really important, that you check that you have seam-free socks. Yeah.
I agree with you with
Yeah.
the socks and the seam-free. And actually, even on this particular picture, I can see those sort of like linear stripes coming up.
Yeah.
And sometimes when I've pulled those socks off patients, and there has been a swelling of the leg, you can actually sort of see the pattern of the socks on the skin. And sometimes you can buy socks with, they're beautiful patterns you can get. You can get ones with little dots, you can get them with love hearts. But actually, if that embroidery has been stitched into the sock, it will often leave little love hearts all over your legs or little dots all over your legs. And actually, that can then create a little bit of pressure change or fluid change, and it might create a rub or a sore or a split. So be mindful of those. So I really like these little dots that we've been popped on here around the top, because you can get socks that have got like a different type of webbing to the seam at the top. So actually, when you put them on, they sort of don't stick. I'm trying to like a bit like a honeycomb look to them. And then the bit at the toe there, that's important too. And I like that because sometimes when the socks are on, they can get quite tight around the toe. And if they've got a ribbing, then you can actually get pressure marks there. And if your shoe is too tight, then you've got the pressure mark being pushed against from the pressure from the shoe pushing against the sock, and then that in turn like rubbing and then creating a little blister. So that's a really good little diagram there to sort of highlight where those pressure areas are.
And are there any simple habits patients should adopt, with socks?
Yeah, so habits. Obviously popping your socks off every single day, taking a look at your feet, but making sure that they're clean socks and that you've changed them. And I'm not suggesting everyone's walking around with dirty socks on, but if you've gone out for a walk, which is what obviously we're encouraging through April, and we've just had, I don't know where you all are in the UK or abroad, but I've just had a massive downpour. So if I'd gone out for a walk just now, my feet would have been absolutely sodden, and hence my socks would have been sodden too. And of course, at that point, then we'd need to take them off and put on some clean, fresh ones. Don't just rely on the fact that we might be able to warm them up naturally with them staying on our body and dry out, because they necessarily won't. So, do make sure you put on clean, dry socks, change them after walks. And if they get sort of wet or moist, change them daily or more often, as and when you need them, because damp, dark, warm, wet environments do create little fungal infection risks. So be mindful of that. So foot problems then, we thought we'd just talk a little bit about some common foot problems. So, as we walk, some of the foot problems might start to develop. So, Ljubisa, do you want to just...
Yeah, well, we have loads of photos here, well, which are not very pleasant, but still we have already talked about certain injuries and problems. And in your opinion, or from your podiatric practice, what are the most common issues you see in clinic?
Yeah, so the most common ones that we'd see really would be thickening of the skin. So that's callus and blisters. We might see corns. Corns come from high pressure areas. So you can see in that top photo of the 2 feet together, there's kind of callus points over high pressure areas. So underneath we call it the first metatarsal phalangeal joint, but that's underneath the big toe there, that bit, sort of big sort of bunion joint, I suppose is what people might know it as. There's some callus, but you can see that intense area of what looks like thickened skin there. And on the picture on the left, which I think is actually the right foot, but it's the foot that I can see on the left looking at the screen, you can see a central pinpoint, and that's more likely to be a corn. And those central corn points are intense areas of pressure. So this particular foot will be overloading in the first, third, and fifth metatarsal heads, so underneath those big toe, third toe, and then a little toe. And then there'll be an intense area of pressure, which then pushes that hard skin, that keratin, and forms sort of like a ball. And that ball then becomes incredibly painful and can cause the tissue to break down through its friction and shear and impacted forces that come back onto our lovely soft tissue that our foot is made up of. Now, the forefoot there, it has got a lot of protective fatty padding, even, get my words right, fatty padding, to protect, to shock absorb, because the bones within our feet, 26 bones in the foot, and they all interact not necessarily together at the same time, but they all kind of have small interactions that are really meaningful. So actually the foot tries to protect itself with a slightly thicker skin on the sole of the foot, but lots of fatty padding for shock absorption. So when we get this overloaded area, the body is quite good at trying to protect itself, a little bit too good in some ways, because building more skin you might think is useful, but actually it then becomes quite detrimental because it creates high pressure, shear and friction. And then that in turn can create pain, tissue breakdown, and then tissue breakdown can lead to ulceration. So those particular spots on those 2 feet are really common for where we might start to develop ulcers or blisters, especially if we're sort of starting a walking regime, which maybe we've not been used to doing. The other one, sorry, Ljubisa, was ingrown toenails.
Yeah, ingrown, yeah.
Ingrowing toenail there. So in other words, if that toenail might have split or cracked or is a funny shape, you might start to see that swelling there of the side of the toe. We've got some cracks on the backs of the heels here from dry skin. Also, it could be that if you've got a fungal infection on the skin, it dries out the skin, it can create those cracks. And those cracks, of course, can become infected or particularly sore. So we tend to advise, I know we spoke a little bit about a good foot care regime, and we spoke about moisturising. And actually, if you've got relatively good skin integrity, in other words, it's not too thin, and you don't live with quite severe arterial disease, you can use urea creams, so 10% urea creams that you might want to consider putting around calloused skin just to break down that keratin. And then, of course, we have a classic thickened nail there with probably what looks like a fungal infection because it's slightly discoloured in there. And they're quite common foot problems as well. And, of course, if you're walking with thickened nails, you really do need to make sure that your toe box area in the shoe is slightly deeper, because then, of course, you've got a bit more room for that heightened nail. But go and see a foot health professional, a podiatrist, foot health professional, so that they can take down that top layer to thin it down a little bit and make sure there's nothing pressing underneath the nail that might cause it to rub or break down. But out of all of these, Ljubisa, out of these sort of four pictures here that we've got, which ones would we say that people should act on much more quickly than others?
Yeah, I would say the corns and calluses. I think that this is a thing which people have to react. They are all clearly conditions which people need to, or patients need to react, but I would say the corns, calluses, because Often, or at least from my practice again, but I had patients, with mostly diabetic foot ulcers, who had ulcers underneath, under the calluses and corns. So,
Yeah.
as you said, skin is doing almost too good job in a way, protecting and trying to make protection for that exposed area, but underneath, under the calluses, ulcer will form, and that can get infected, and they can be really, really deep. Also, affecting the bone occasionally. Yeah.
Yeah, so I mean, and of course, if it does, any break to the skin is really important to consider. So that ingrowing toenail there as well, that's obviously a portal for infection. So we've got, I mean, we've kind of gone, there's not one thing here, is there? There's kind of like
Mm.
several things we need to keep an eye on, really. It's, so breaks to the skin, infection, pressure areas, damage, areas that we need to, again, proactive rather than reactive. So, try and reduce these problems before they get to actually be a great concern, because they can go wrong quite quickly. So if we do tend to find something, a break to the skin then that we've got, what do we do when things go wrong?
Yeah, so, firstly, I would say clean the area. It can be a tap, drinking water. It can be a sterile saline. It really depends what do you have at hand. Dry area, especially in between toes. Apply sterile pad dressing. It can be very simple dressing, nothing fancy, and try to reduce pressure on that area. And then I would say seek help, escalate. So don't wait too long, as Joe said, 24 hours at most. So contact GP, contact nurse, and get a professional to have a look. Of that change or injury. Mm.
Yeah, that's it. So, don't wait too long. If it's looking like it's healing, sort of be mindful of it. But if you're thinking actually this has gone on a bit too long, what is actually going on here? And of course, here this is when things can go wrong a little bit, isn't it?
And we can see ulcer here. And why are ulcers such a concern?
Well, they can develop quite quickly. I mean, we mentioned earlier in that slide about calluses and shear friction, and you can see it's a really classic example where that overload of those forefoot joints actually have created now this pressure damage, which has developed into a break into the dermal layers of the skin. So we've got the epidermis, which is on the top, and then the dermal layer, and this is so you can start to see there that that's actually started a tissue breakdown of the dermal layer. So it's important that they are a concern because they may not be felt. Remember, we've spoken about neuropathy, that you may not heal quickly because of the circulation, maybe fluid overload. So that it might be that the environment for the wound isn't quite right. And so they can then carry a risk of developing infection quicker. So, healing is also slower in chronic kidney disease because of all of those reasons: the neuropathy, the vascular supply, the filtration levels, possibly if you're living with diabetes, the sort of higher sugars within the blood, extra fluid. So, not every foot ends up with a problem, does it? But, what's the key message for prevention then? Ljubisa, are you still with me?
Yeah. Sorry. I would say regular checks and acting early. Don't ignore small changes. Be as Joe said, proactive rather than reactive. If something happens like this, it is not as bad as it looks. Things can be still sorted as mentioned, but prevention rather than treatment, if possible.
Yeah.
I'm being mindful of the time, Joe. I know that we could really talk about.
Oh, sorry.
But we have 7 minutes left. I think that we have, in essence, described
A
Charcot.
Charcot foot.
So
Okay.
perhaps we could skip this and just
Yeah, red hot, swollen, not
yeah,
always painful, sometimes painless, isn't it? So be mindful
yeah,
of any red hot and swelling that you might
yeah,
develop.
yeah, yeah.
Building up your steps then. So we're thinking about walking still, aren't we? How do we build up these steps to do your 2,500 steps a day? So, if you haven't started, if you're not positive about sort of getting on to 2,400 steps a day to begin with, start small. You can add 100, 200 steps every few days. Use a pedometer or a phone, and you can check your feet for any rubs. But you need to really celebrate your successes, because actually the further you go, the better it will be for your cardiovascular health and your overall general well-being, as well as your mobility and your rehabilitation. So really think about building up your steps. What about safe walking tips, Avija? What about those?
Yeah, walking on even surfaces, avoid new shoes for long walks, keep feet dry, and try to check feet after the walk. Use any assisting devices which you use because you don't want to fall down, or because of, I don't know, lack of balance or anything. So and take it with small steps, and then develop the momentum.
Yeah, exactly.
Yeah.
When do we seek help? So we seek help for our feet if there's new areas of redness or swelling. Look at your feet today. What do they look like? Maybe take a photo, because maybe in 2 years' time they look very different. Have you got any new areas of redness, swelling, cracks, blisters, breaks of the skin? Is there any dampness or wet between the toes? Have you got color changes, temperature changes, sudden pain? If there's a split, are you beginning to feel unwell or dizzy, or think about infection versus inflammation? But alert somebody, seek some help, ask for some support, take some photos, send pictures into your foot health teams and see what they can do. So we've got some other take-home messages here, haven't we? And one of them is you can get some more information to at the Royal College of Podiatry. They've got further information on walking, so you can go and there is actually a link here, but I'm not sure it will work on this webinar. But just Google the Royal College of Podiatry information on walking, and it should pop up, because I had a check there earlier today just to make sure it's all there. So walking is safe and beneficial. Be mindful of using any walking aids or devices that you might need to keep yourself safe. Good foot care prevents complications. Have a look at your feet, ask for support. The right footwear protects you. Ask for early help, because prevention is better than reaction. Hopefully you'll be able to achieve your 2,400 steps safely this next month, as it is. Obviously, all profits go towards the NKF, so really try and sign up. And I think there may be a small donation for a pair of lovely socks. Talking of donations, then, we've got some very exciting news. There's 2 people running the London Marathon this year. So if you're going to spot people, you can, on the apps, there's Ed Gorman, who is a real advocate for the National Kidney Foundation. He's run more marathons than I would care to think about, really. His poor feet have run probably more times around the world than most people I know. And he's raised so much money for the National Kidney Foundation. So keep an eye out for Ed Gorman. Another person close to my heart, actually, a family member. This is my auntie and my cousin here. Johnny is living with a transplant. His mum kindly donated it to him. He's from Edinburgh. So if you're in the Edinburgh area or up in Scotland, look out for Johnny on his way around the London Marathon. I'll be tweeting and posting. So if you follow me, you can have a little look at there too. And he's come a long way. So both these guys are going to be absolutely awesome on a London Marathon day. Now, obviously, this challenge was to do 72,000 steps in April. These guys will be doing 72,000 steps probably in about 5 hours or so. So we're not expecting anybody to be at that level. But we wish them well, don't we, Ljubisa? Just give them a real whoop whoop from us to going around that block.
Yeah.
Be very good. But if you are a little bit more ambitious than just doing your 72,000 steps, and you are looking to try and increase your activity levels, the NHS does have an app which you can do, Couch to 5K. It does start very slow. Be mindful of seeking help from a healthcare professional and making sure that you're fit enough to be able to start considering running. Start with walking, small steps. That's what we wanted to talk about, really, wasn't it? Pace your own race. So it's not the destination, it's the journey. And so on that, then, I think we might have just done our 7 minutes.
Thank you ever so much for your time. That has actually flown, and absolutely amazing. We are running out of time, but I'll quickly do a couple of questions. Is there any recommendations for the most effective moisturizer to use?
Yes, let me just stop sharing and I'll come back on the screen, because I can't see anybody here at the moment. Have I come back into the screen? Yeah, I'm back
Yeah,
in the
yeah,
screen.
now, yeah.
Yeah. Yes, effective moisturizers. So ultimately, it's whatever moisturizer suits your skin. So lots of people have got lots of different creams in the cupboards, and you can use whatever, any sort of moisturizer really. However, if you are living with a little bit of dry skin or hard skin, like callus, then you can use creams with a urea base within them.
Mm,
Try to avoid putting them, of course, onto too many cracks and splits because you want to try and treat the wound. But urea 10% is a great option to start with if, as long as your skin isn't too thin, because remember, urea strips the skin. It's a keratolytic, so it breaks down keratin. And if you have a very thin area of skin, to put a keratolytic on a thin area, you might end up with a light sensitivity. But 10% is usually what's recommended for trying to reduce dryness, callus, especially around the heels. But do not pop it in between the toes, only because you then create that wet, warm, hot, boggy environment, and that can cause fungal infections. So be mindful
mm.
of that. Anything from you, Ljubisa? Have I covered that one?
No, no, I think that you have covered.
So let's do one more question before we close then. Can you just quickly cover cellulitis? Because there's a couple of questions on that.
Yeah, so cellulitis is a inflammation of the cells. But it can lead to infection. So people talk about cellulitis. Itis, like tonsillitis, is infection, can be bacterial infection of the cell. So of course, if you have a split to your skin, you could develop cellulitis. It sounds, you know, I mean, it's obviously a medical term. It can sound quite scary. Sometimes it can be localized cellulitis. So in other words, it's something that can be a bit more managed. If it's a very big cellulitis, red, hot, swollen tissues, then actually you might be sort of really needing to get some antibiotics for that. But you need to seek advice for that because we've got to think about our antibiotic stewardship. And of course, if you're living with kidney disease, the impact of some of the antibiotics on your kidneys is important to consider because you won't be able to have the full range or even the full dosage. So it really is about trying to protect your feet, preventing cellulitis and getting that inflammation within the tissue. From your side, Ljubisa, have I covered?
Yeah, perhaps only if you feel the chills or have a feeling of fever, this would signal that perhaps infection is getting systemic. So yeah, seek advice.
Yeah.
Thank you both. Thank you ever so much for everyone that's turned up tonight. If you do want to take part in Best Foot Forward, all you have to do is go to the website and get walking 72,208 steps in April. We'd love you to join. Our next webinar is Wednesday, May the 13th at 5 o'clock. And we're going to be talking about caring for your line while you're on dialysis and your day-to-day life with caring for the line. So something completely different. Have a great evening and thank you for joining us. Bye-bye.